Hi, I'm Emma and I'm one of the midwives at Ashford and St Peter's Hospital. I'm going to talk to you today about what to expect after your baby is born. The earliest you can go home after having your baby is roughly 6 hours. During this time, we would want to know that you're able to pass urine by providing 2 samples. We also want to make sure that your baby is healthy. Your baby will undergo a check either by a paediatrician or one of our trained midwives. You will then be issued with a health record book for your child. This record book will be a place for documentation by your midwives, health visitors and other healthcare professionals through your childhood. When you're ready to go home, your midwife will undertake a discharge conversation with you. They'll give you lots of information that you may find is difficult to absorb at the time. Don't worry, because this information will be repeated to you by your community midwife once you go home. Before going home, you might find that you have a hearing test carried out, or you might be invited at a later date to come back to have your baby's hearing checked. When you go home, your community midwife will come and visit you on the first day after you've been home. They'll see how you've been for your first night, and they'll give you any of that information that the midwives at hospital gave to you again. They'll help you with any feeding support, and they'll check you and your baby to check that you are feeling well and that you're healthy. The next scheduled visit that you would have with a midwife would be on day 5. On this day, your baby will be offered the newborn blood spot test. We'll ask you to consent to this test. Information can be found in the red record book that you will have, and your midwife will talk to you about this in detail. This test is offered to all babies in the UK. We'll also weigh your baby on this day. Most babies will lose some of their birth weight by day 5. This is completely normal. We will advise you if there is anything that you need to do before the next visit. We would then routinely see you on day 10 and weigh your baby again, in which case most babies will have regained back to their birth weights. There may be times that we see you in between these normal visits. For instance, we may come and weigh your baby more often, or we may come to see you for other reasons and to provide you the support that you need. For some people, you might need enhanced care. This may mean seeing a midwife on a regular basis up until your baby is 28 days old. This will be discussed with your midwife, and a plan will be put in place before you go home. Or if you have a home birth, it will be discussed at the time.